Hello everyone, this is Mr. Matus and I'll be presenting to you the stages of burns. Burns is a very important topic in the NCLEX, especially that nurses need to know the symptoms of burns and the nursing care that must be implemented based on the stages of burns. So there are two stages of burns and they involve complex pathophysiology, and I will try my best to explain the pathophysiology as simple as possible so that you could understand the symptoms and the complications and apply them to your NCLEX. So before we start, it is very important to review again the body fluid compartments in the body, or where we can find the fluids. Now we have to remember that there are two fluid compartments in the body. The fluid that is found inside the cells, you call that intracellular fluid. So these are the fluid found inside the cells here. Now the other fluid compartment would be your extracellular fluid compartment, and the fluid here will be found in two other compartments. So you have the interstitial fluid, which is still under your extracellular fluid, and the interstitial fluid will be the fluid found here between your cells and your tissues. And another compartment under the extracellular fluid will be your plasma or intravascular, and this will be found inside your blood vessel. The plasma or the intravascular fluid is found here. So these are the basic fluid compartments that I want you to remember, because when I discuss later on the pathophysiology, we'll be discussing a little bit about where fluid is going whenever there is a major burn injury. So the pathophysiology of burns is characterized by two main stages. So the first stage is called the hypovolemic stage, and that happens on the first 48 hours after a major burn injury. Now, after a major burn injury, what happens is the dilation of the major capillaries of the body. And when there is dilation of the capillaries, this leads to increased capillary permeability. Whenever there is an increase in the capillary permeability, it leads to the shifting of fluid, a rapid shifting of fluid, which is from the plasma to the interstitial fluid space. Because of this shifting from the plasma, which is your intravascular, to the tissues, this leads to edema, and that's why patients with burns have blistering. Now, with the destruction of the cells, one electrolyte that is very important to remember because of the shifting is your potassium. So your potassium from inside the cells will move into the blood vessel or the vascular space, and that brings about the hyperkalemia. And hyperkalemia in the first stage of burns, we all know that when the potassium level is very high, that would lead to cardiac arrest. Now with the fluid shifting, the major impact of that is going to be a decrease in the blood volume and a decrease in the blood pressure. With a decrease in the blood volume, that will also decrease the circulation to the vital organs, especially the kidneys. And the kidneys cannot function without the blood volume. So with decreased blood volume, there will be decreased renal perfusion that will lead to acute renal failure. So this is the general picture of a patient after having a major burn injury on the first 48 hours. So here, as a review, this is your plasma fluid or the intravascular space, and you have the intravascular fluid inside. And this plasma, because of the dilation of the capillaries, what will happen is an increase in the capillary permeability that will allow the plasma to rapidly shift into the interstitial spaces. So plasma transfers to your interstitial spaces, and that leads to the presence of edema here, and you have a decrease in the blood volume that will lead to decreased perfusion of the kidney that will lead to acute renal failure. So remember, after a major burn injury, our goal is fluid replacement. And we all know that the major cation inside the cells are your potassium. So with all of this potassium and with the presence of cell destruction, this potassium moves inside the blood vessel, and that leads to the development of hyperkalemia. And with hyperkalemia comes the possibility of a complication, which is cardiac arrest. The second stage of burns is called the diuretic stage, and it happens on the 48 to 72 hours after a major burn injury. And at this time, the shifting of fluid will be the opposite of the first stage. So the shifting at this time will be interstitial to plasma fluid shifting. That will lead to an increase in the blood volume. And with increased blood volume, that also increases the circulation of fluid or blood into the kidney. And that's why there will be an increase in the urine output. And that's the reason why the second stage is called diuretic stage, because of the increase in the urine output. But we all know that once there is an increase in the urine output, what is the major electrolyte being lost in the urine? That would be your potassium. And during this stage, you will see that the patient is going to develop hypokalemia because of the increased urination. Now, a major complication of increased blood volume will be circulatory overloading. That could lead to the patient developing heart failure. So during this stage, it's very important to monitor the patient's lung sounds for crackles to ensure that we are detecting this major complication. So as what you can see, there are differences in the symptoms or assessment on the first stage of burns to the second stage of burns. So here is a review. On the second stage of burns, what happens will be fluid from the interstitial space moves into the plasma. So the shifting of fluid now is interstitial to plasma, and that increases your blood volume. And with increased blood volume, that also increases the circulation of blood into the kidney, and that increases your urine output, and that's why the second stage is called the diuretic stage. And also because of the increased urine output, we expect that the patient will develop a drop in the level of potassium or hypokalemia. And also, lastly, remember that with the increased blood volume, this will also increase the workload of the heart and the possibility of a heart failure. So this is just a comparison of the symptoms between the stages of burns, which is your hypovolemic stage and your diuretic stage here. So here what you could see would be the plasma to interstitial fluid shift, and here will be the interstitial to plasma fluid shift. So remember that. And you could see the symptoms on the left side compared to the right side also. So here you have hypovolemia, while on the other side you have hypervolemia. Here the main problem is hypovolemic shock, and this one is heart failure on the diuretic phase. Here on the first stage you have hyperkalemia, but here you have hypokalemia. On the first stage, your main problem is oliguria or even anuria or renal shutdown, but on the second stage you have polyuria, which is increased urination. With decreased blood volume on the first stage, there will be hemoconcentration, and that leads to increased hematocrit. And on the second stage, you have hemodilution, which leads to a drop in the hematocrit of your patient. On the first stage, you have low sodium level because of the burn injury and the fluid loss. and that's also the same thing as on the second stage. On the first stage, you have metabolic acidosis. On the second stage, you still have metabolic acidosis as well. So I would like you to take note of this comparison because your nursing care for the first stage will be different to the second stage. Especially on the first stage, it's all about fluid replacement. But on the second stage, it's going to be a different approach since the patient may be already having hypervolemia. So this is just a very quick review, everyone, of the stages of burns or the pathophysiology of burns. And I hope that this will help you a lot in answering questions in NCLEX about burns. So for questions or for more information, you could post your comments below. And please don't forget to click like or share my presentation or subscribe to my channel. Or you could also email me at info@matusnursingreview.com, or you could also visit my website at www.matusnursingreview.com. Thank you.